Withholding estrogen should be a crime, especially when we have the data out there that we know how women feel with it, even on low dose therapies, how they feel with it and then what they feel without it. It's not like it's a guessing game at this point. And the fact that women are always left estrogen starved is a crime. It's a crime against humanity because
Mm.
everybody feels the effects of female estrogen deficiency. Everybody. Hello, everyone. You're listening to the Menopause Moxie podcast, where we strategically challenge the status quo on perimenopause, menopause, and female hormone balancing. I'm Marie Hoäg, clinical hormone coach of 20 years, here with my producer and co-host, Maggie Kuhn. Welcome to the show. After working in the female hormone industry for over 2 decades, I've seen the same questions surface again and again. Questions women seem to not be able to get real answers to about perimenopause, menopause, and hormonal balance. In today's episode, I'm cutting through the noise and the fluff to give you clear, clinical, evidence-based answers to most of your pressing hormone questions. The kind of truth you will never get in mainstream menopause conversations. If you've ever wondered what really happens to your mind, your brain, and your body, what balance actually means, or how to get your hormones balanced, this is the episode for you. Hi, Maggie. How are you today?
I'm doing well, Marie, and I'm really excited about this episode today because, as you mentioned in your intro, there are so many questions that women have. And unfortunately, we have gotten to a place of, medical care by social media input. And that's not a good way for women. It's a good place to go if you want to ask some general questions or get some general feedback. What are people doing? Get a sense of things. That's actually how I found you. But when we get into some of these deeper questions and women are very desperate for answers, you need an expert. So today we're actually going to look at some of the questions that have come in, and I've selected several because I think they're going to resonate for our audience. They're pretty complex. They're not just straightforward one question. There's many things buried within them, and I know with all your expertise, you're going to be able to pick that apart. So should we jump in?
Yep, happy to do it.
All right, here we go. First question. I got my labs back. My testosterone was only 12. My husband is worried about me taking testosterone. He said, once you start taking it, you have to take it forever. He said I can do things naturally to raise it. What are your thoughts?
So a level of 12 is not a great level. However, it's not really testosterone we want to address at this point. Testosterone is really one of those hormones that need to be put off until estrogen and progesterone are fully restored. This gives us a better picture on how much testosterone a woman really needs. Because once you restore estrogen and progesterone, this changes the production of other hormones. This is one of the reasons we wait until the second phase of HRT to introduce other hormones. But it's not uncommon for doctors to lead with testosterone therapy. So that's one thing about the testosterone. She talks about how her husband is worried about taking testosterone. One thing I really want to share with women is you cannot balance your hormones based off of somebody else's fear. Your husband's fear, your doctor's fear, your mother's fear, your sister's fear, your friend's fear. You have to figure out on your own what you need and not listen to other people's fears. So your husband is fearful that you have to take it forever. And that could be, the checkbook that he's looking at. If you start this, you'll be on it forever. Now we have to pay for it forever. But it's true. You do have to take hormones forever if you want the benefits of those hormones. But again, like I said, she may not even need testosterone when she gets her estrogen and progesterone balanced. So if you're going to be taking a hormone for life, you want it to be your main sex hormone, so all other hormones in your body will function the way they're supposed to. So yes, you do need to take hormones forever if you want the benefits of it. You're not tied to them forever. If a woman ever decides to stop taking hormones at any point, it would be just as if her body stopped producing those hormones, and then her brain and body will slowly deteriorate and decline like it would if it didn't have these hormones in the first place. The second point I'd like to make about on this question is that the husband said that she can do things naturally to raise her own levels. This is not true. A woman cannot do things naturally to raise her own testosterone levels consistently. And he's focusing on what works for him. Raising testosterone in women is not the same as raising testosterone in men. Women cannot raise testosterone levels the way that men can raise testosterone levels naturally. So there's no food or product or exercise a woman can do to increase her own testosterone levels, especially on a consistent basis. And I get back to, if really the only way we've seen this work consistently is to restore estrogen. So if a woman is really looking to restore her testosterone naturally, then she would take the time to restore her foundational main sex hormones, which influence the secondary main sex hormones, which is testosterone in women. So we've seen plenty of testosterone increases when women fully restore their estrogen and progesterone. Not all women. Some women will get a reduction of testosterone. And again, this is why we don't restore testosterone until we fully restored estrogen, to see if a patient even has testosterone deficiency now. Estrogen really is the regulator of all other hormones, from the production to how women are affected by those hormones and the levels they get. So my thoughts on this, and if she's asking for my recommendations, I would certainly recommend that she focus on getting her main sex hormones first, and then retest for her testosterone to see if she even needs it at all.
Thank you. All right, next question. I was postmenopausal 11 plus years when I started HRT 3 months ago. I take 200 milligrams of progesterone, 2.5 milligrams oral estrogen. My labs are still low. My E is 32 and P is 1. 3 days ago, I switched to the transdermal patch, 0.05 milligram 2 times a week. For the first time, I started spotting today. I also don't feel well. My gut tells me that going from 2.5 milligrams oral to 0.05 milligram patch is dropping my E. Or could it be the other way around, which would tend to cause spotting?
Okay, so there's about 4 points that I'd like to make with this woman's complex question. What she was prescribed initially is the standard of care that most women tend to get when they go to practitioners who have no real formal education or training in advanced hormone replacement therapy protocols. Oral estrogen is considered first generation HRT. It is designed for symptoms management. It is a synthetic estrogen that passes through the liver, so we get inconsistent blood level readings with oral estrogen. It's just one of the old school ways that doctors, it's a good way to tell if a doctor has education or not in hormone therapy. Doctors who prescribe first generation HRT like oral estrogen typically never get hormones balanced because they're under the impression that estrogen has to stay low. Instead, these doctors start loading women up with progesterone because there's a greater fear over estrogen than there is progesterone. And since progesterone also has the reputation for being a calming hormone, they think, oh, well, we're going to give you this calming hormone for all of your anxiety and depression that estrogen deficiency is causing. And because I'm not afraid of progesterone, I'm going to give you this progesterone to help calm your brain, thinking that it's going to do the job. But these doctors don't test labs much. They don't know where estrogen should be or where progesterone should be. This is really crapshoot medicine at its best. So we don't really expect much from this. Well, actually, we do know what to expect from this protocol. Nothing, zero, goose egg. What we're expecting is women to still feel cruddy, to still feel miserable, even though they're on hormone therapy. So her hormone therapy, the first protocol was first generation and not clinically effective. Then she switched over to 3 days ago. She switched over to a transdermal patch, 0.05 twice a week. So, and then she said for the first time she started to spot that day, and she doesn't feel well. When a woman switches hormone replacement therapy protocols, say from an oral estrogen, first generation really is what she was on. Now she's switching over to a second generation, which is patch therapy. Women will have different experiences on these protocols. They are not interchangeable. The dosing isn't interchangeable. What patients yield out of these protocols isn't interchangeable. It is like starting over. It takes about 3 to 3.5 months for the body to fully adapt to a hormonal change or protocol change or a hormone adjustment to assess whether your hormones in 3 days to determine whether your hormones are balanced or not is really absolutely ridiculous. It just doesn't work that way. And she did say that she felt that this was uh, um, that it was her gut telling her that going from the 2.5 oral to the 0.05 patch was dropping her estrogen level. That could be, but regardless, we won't know for about 3 to 3.5 months, because really making a hormone adjustment, it's just, we're not even started yet with the body fully experiencing that dose. So it's just really hard to tell what caused her to feel yucky, but women do feel yucky when their estrogen is low. Just because there's a dosing adjustment change and maybe there's an increase of estrogen doesn't mean it's going to make a woman feel good. And she may feel good for an hour or two or a day, but it will go back. She will go back to feeling cruddy because she hasn't fully restored her hormone tank. This is still considered low dose therapy, second generation therapy at that. So, and it's hard to tell whether there's a drop, but it's likely that there could be a drop in her estrogen from switching that protocol. But again, it's neither here nor there at this point, because it doesn't really matter for another 3 months down the line to see what we were able to get from that. And then we would dose according to what the patient was able to get out of that protocol. And then she was asking which would cause the spotting. Estrogen deficiency, low estrogen causes spotting. The best way to get rid of spotting and to restore a healthy menstrual cycle is to restore estrogen at therapeutic levels. So estrogen really does dictate the menstrual cycle for women. A lot of doctors who are not educated about estrogen think it's progesterone. And though, yes, you can load a woman up with progesterone and stop her period, but you've just messed up her cycle. And that is not how a woman's body is physiologically designed. The woman's body is physiologically designed to produce very low levels of progesterone in the follicular phase, and an increase of progesterone to a peak at day 21, and then a drop off around to an all-time low at day 28. And with this rhythmic pattern, along with low estrogen in the luteal phase, then a woman sheds the lining of her uterus. But if there isn't enough estrogen and if progesterone isn't cycled, then there is no menstrual cycle. If a woman doesn't want a menstrual cycle, then yes, she can lower her estrogen even more, because what she's doing with these levels is, if she's having spotting, then there's a waking up of the uterus, but only slightly. And so there isn't enough for a full menstrual cycle. So she'll either have to lower her estrogen to shut down the uterus and stop the spotting. But the side effect of that is now a woman is sacrificing what she gets mentally and the mental and physical benefits of the estrogen if she were to restore her menstrual cycle. That was probably more of a complex answer than the question itself.
Well, it's a complex question. And I would just add here that others who are listening and can relate to this question, it might be in that same sort of age range category. We just did an episode on reversing menopause that you might want to check out. All right, moving on to our next question. This is really good stuff, Marie.
I'm glad you like it. Yeah, they're complex and the answers aren't easy to answer either.
Well, I think these questions just demonstrate how desperate women are for answers. They don't know where to go. And it's pitiful that doctors can't answer their questions, but it is the situation that we're in right now. And so I'm just grateful that we have this opportunity for women to send their questions in and for me to bring them to you, and you can pick them apart and help women understand what's going on.
Yeah, you made a point at the top of the show when you were talking about that women go to social media to get information, but they have to be careful with what information they get. And this is the tough part because they don't know what information is real. They don't know what's working. They think that if something is working for one woman, all they have to do is switch it over. The next day, they should feel the same way. And it really does not work that way. So I'm just not a big fan of going to social media. But like we've talked about before, it's like, where are they to go? Not even their doctors are trained in full restoration. And it is treated like just and I continue to use the term like a crapshoot. Let's see if this works. Let's see if we can win with this combo. Let's see if we can win with this combo at women's expense. So I'm excited for the third question.
All right, here we go. I'm 47, always been healthy and active, but since turning 42, things changed. My hair started shedding like crazy, got a frozen shoulder, then SI joint pain, stiffness in tendons, ligaments, and later plantar fasciitis that never fully healed. My rheumatologist says I'm borderline autoimmune, but I also wonder if this could be perimenopause. I'm seeing an OBGYN tomorrow who treats menopause symptoms with HRT. Do these symptoms sound like perimenopause to you? And what questions would you recommend I ask at my appointment?
Well, I tell you, women who have been healthy and active and experience perimenopause, it can hit them hard because they're used to feeling healthy and vibrant and being active. And then now they're not able to. And now they're experiencing pain that they're not used to. And what tends to happen around this time is it's not that they're changing their diet or lifestyle. What is changing is their ovaries are failing them. They're producing lower and lower estrogen levels, which is shutting down their ovulation. So now they're producing lower and lower estrogen and progesterone levels, which will impact the menstrual cycle. Some of the clinical indicators of this decline in a woman's 40s, late 30s, and even, late up to late 40s is women will lose their hair and it will shed. One of the reasons for this is the hormone levels sends a message to a woman's brain that tells her what stage of her reproductive life she's in. And I talk about those 10 stages of reproductive aging chart that I reference quite a bit. And usually in stage 1 to stage 2, women will start to lose their hair because of estrogen plummeting. And it does not get better. It gets worse as estrogen continues to decline. She's experiencing some things like frozen shoulder and joint pain and stiffness from tendons and ligaments. One of the reasons this happens is when estrogen declines and it gets low enough, the body stops holding on to fluids. It stops holding on to water that the body utilizes that acts as a cushion and a lubricant between joints. Muscles are dependent upon plenty of water and moisture in the muscles to help with flexibility and to help get rid of stiffness. And women also get electric shock from this dehydration. But what happens is when estrogen declines, the internal body begins to dehydrate. The tissues and organs start to malfunction and deteriorate. And this is what tends to happen. And what's nice about this is when you restore hormones, these things go away relatively quickly because the brain says, oh, I need this water, so I'm going to use it to rebuild the body. Liz was a patient of ours who had this autoimmune disease, rheumatoid arthritis. And I have to say, it was probably in the first or second year that I was in this field. And what was noticeable about this particular patient is I started following her treatment at the beginning when she first came in the clinic, when I was relatively new too. At a young age, she got this very rare autoimmune disease that gave her this arthritis. So to see a young woman with severe rheumatoid arthritis, and as I watched her develop it, each time she came in, she was worse and worse and worse. I had never seen anything like this before in my life, this progression of this arthritis. And this is when we were really digging in deep and learning all that we can about hormones, especially what we were learning about estrogen. Estrogen is one of the most powerful anti-inflammatory agents women have access to. There is nothing more powerful to a woman's immune system than estrogen. Estrogen is autoimmune protective. It is designed to protect women from diseases, especially autoimmune diseases. So this is why it's so important for women to understand how much estrogen their body needs, because this woman is clearly being affected by her estrogen deficiency. But because doctors are not trained about estrogen and its impact on autoimmune diseases, they would not make the link between estrogen deficiency and this. And in Liz, who came in, the other shocker was the fact that we started, and this is when we were learning low dose therapies, and we were shocked that the clinical benefits that she was getting, we were just learning second generation HRT, but the relief that she was getting. This lady, she was a young woman, she ended up moving to New York and changed her treatment up with another doctor that we referred her there. And so she's getting treatment for. But from what I understand, that we haven't stayed in contact, so I can't say with certainty. But what I was watching with my own eyes, even with second generation HRT, it was turning this around, and it was just really making it. This is one of those things that was making us question estrogen and its impact on the body from head to toe. This is where we were learning that there isn't one thing in the female body that estrogen does not influence. So when she says that her rheumatologist says that she's borderline autoimmune, I tell you something, I like to trick doctors who say stuff like this and have the patient get on estrogen and not tell these doctors. And then when they go back to the doctors and the doctors are taking the study, they see for themselves from whatever diagnostics they have the change, and they look at the patient and they say, "What did you do?" Because this does not happen on its own. You've done something, and you, the patient, will know that it was because of the estrogen that made this change. And this is really the only way that doctors say, "You did what? And when did you start? And this is the way it was before you started, and you took this and you've been on it for 3 months, and now these are the clinical results." This is what opens their eyes. Doctors, when they start to see these clinical results with their own eyes, they start listening, they start leaning in, and they start wanting to know, now, how much did you take and how did you take it? And the more doctors that are open-minded like this, are the world would be a better place if we had doctors that did this very thing. Then the second part of her question is, but I also wonder if this could be perimenopause. Let me be really, really clear. Perimenopause does not have symptoms. Perimenopause is a symptom, just like autoimmune disease, just like depression, just like heart palpitations, just like anxiety, insomnia, joint pain. Perimenopause is just really a cluster of symptoms that women have that they associate with this time period. But perimenopause does not, or its symptoms do not exist when women's hormones are fully restored. So a better way to look at this is it estrogen deficiency that this could be, not necessarily perimenopause? That's what we should be asking. So perimenopause doesn't cause things like this, but estrogen deficiency does. So the other part of her question was, I'm seeing an OBGYN tomorrow who treats menopause symptoms with HRT. This is really critical. OBGYN gynecologist, 98% of them are trained to treat the symptoms associated with menopause. Now, like perimenopause, menopause does not have symptoms. Menopause is a symptom. It is a symptom of estrogen deficiency. So if you want to manage your symptoms of estrogen deficiency for life, go to this gynecologist. And if they're trained on any sort of estrogen at all, they're probably trained on second generation HRT, but no more than that. So the best thing you'll get out of a gynecologist is a first and second generation HRT system designed to keep women in a state of deficiency. Gynecologists have to be probably the worst in a handful of physicians that are the worst to go to for hormone replacement therapy. They have the greatest fear against estrogen. They are under the impression that estrogen causes cancer. They try to talk women off of estrogen, and they try to put them on other things and make women think that this is going to be better for them than estrogen. They do not know. They haven't worked with therapeutic dose estrogen long enough or have been trained in it. They haven't worked with it long enough for them to see for themselves the clinical benefits of full restoration. So these practitioners, this doctor will treat your menopause symptoms, your estrogen deficiency symptoms, with products, treatments, surgeries, you name it. It will be a lifetime of treating symptoms. And this is where I would like women to understand is you don't have to do this. There's a better way. You don't have to just spend the rest of your life managing the symptoms of hormone deficiencies with things. And then the other question, she says, what questions would you recommend I ask at my appointment? Well, I have a great list of questions that I will talk about in our next episode on how to find a good hormone doctor and the 15 questions to ask before starting HRT. I'll also have a downloadable PDF that you can consider and make notes when you listen to the episode. But one, you want to go to a doctor who already has a plan, who has been doing this long enough that they know exactly what to do. You should not be the first person that comes into their office that they're trying to figure this out. You need to go to a doctor who's been trained on therapeutic dose estrogen, at least third or fourth generation HRT systems, full restoration systems, not low dose symptoms. So you'll ask the doctor, one of the questions that you want to ask the doctor, what's your viewpoint on estrogen? Have you been trained on it? Don't be afraid to ask your doctor if they've been trained on estrogen. You have to know their viewpoint on estrogen. Any doctor, any prescriber that you go to that has a fear of estrogen will never get your hormones balanced, not ever. It will be a continuous exercise wheel of low dose therapies and managing symptoms with other things. Because really, the person that you hand your brain and body over to for HRT is the one that will impact your mental illness and your physical health the most because of what they're prescribing. So it's critical to understand this. Yeah, that's a complex, good question, a lot of points.
I also feel really hopeful for this questioner in particular because many of the symptoms that she was talking about, I also experienced, and it's all gone with therapeutic dosed estrogen. So, she has a real opportunity here, especially being 47, to do a major intervention here and get her life back.
Oh yeah, this is a great time for a woman to get on a fourth generation HRT system and completely avoid menopause altogether. Reverse the perimenopause and get rid of the menopause altogether and the symptoms associated with those conditions if you address the root cause.
All right, next question here. I started the estradiol patch last night, feeling anxious/nervous. Normal? Ringing ears. Can I take it off and wear it again tomorrow?
Okay, so there's about 3 points to this question. Anytime a woman starts a hormone replacement therapy, even the patch, even a relatively low dose patch, a woman can have what we call negative clinical indicators. They can experience positive clinical indicators and negative clinical indicators at the same time. Some of the negative clinical indicators is that women can get anxious or nervous and they can get a rapid heartbeat. This is because the estrogen is waking up the body. It's waking things up. And sometimes that can make a woman feel nervous. This goes away as the body adapts to estrogen. When you give a woman more estrogen than she has receptors for, a woman can experience these types of negative clinical indicators. Not all, but a small percentage. And clearly she hasn't been on estrogen, took it, and she was having these, but this will go away as the body adapts. And then it won't come back again if you get the hormones dialed in right. So this nervousness can be, yes, at the beginning when you start hormone therapy, and the anxious nervous feeling can also be when you have too much. This is why we focus on the hormone sweet spot, on the just right amount. The ring in the ears issue is I would not throw this in the hormone patch pile. Ringing in the ears, what we've noticed more is ringing of the ears is more related to estrogen deficiency. Tinnitus, we see tinnitus go away in women when they fully restore hormones. I don't think the ringing of the ears here has anything to do with her just starting the patch. I think it's because she's already estrogen deficient and she's experiencing this now. It's estrogen is not known to cause ringing in the ears. It's actually known to get rid of ringing in the ears if it's dosed correctly. Then her last part of her question is, can I take it off and wear it again tomorrow? Absolutely not. You cannot take it off and put it back on like that. The goal of taking hormone and starting hormone therapy is to get your body acclimated to the dose. And women will have negative clinical indicators. Very few women don't have negative clinical indicators, but most women do have positive clinical indicators at the same time. If a woman knows that breast tenderness, maybe a mild headache, nervousness, or being anxious, or maybe a heart palpitation in the beginning, that's normal. That's telling us that we gave you a higher dose than your receptors. Your body is responding to it. Now it's going to produce those receptors so that your body can effectively utilize and prepare that estrogen for methylation later. And so this takes a cycle or two for the body to adapt. But a woman should not get the heart palpitations in a few days. But taking that patch off now, you're lowering the estrogen. And if you were to put the patch back on, you'll have the same response because you don't have enough receptors to tolerate that dose. So it's really, and this is why women struggle in the first phase. It's if you understand that this is a thing and why it's a thing, and you'll know when it's going to go away and why it's going to go away, it makes it more tolerable. So this is very typical of first phase, and it does go away. So, but you can't take it off and put it back on again. This is not hormone therapy at all. And this will make you feel worse. That doing hormones this way, this on, off, switch this one day, switch this way, if you want to cause depression, if you want to cause anxiety, if you want to cause mood swings, horrible periods and menstrual cycles, do this. Switch it up a lot, because this is exactly what causes this. If you don't want these things, then get on a protocol that your doctor knows exactly what to do. But fully restoring hormones is a titration adaptation process. Give the patient a therapeutic low dose, the body adapts, you change the dose, the body adapts, you change the dose to the point where the patient is in their hormone sweet spot. And that's how it's done. And if your doctor has not trained in this, you'll never get there. This is why it's important for you, the woman, to know about estrogen, about HRT, and where to go to get the type of care that you need. Yeah, this should
Well,
not be like this. Women should not be guessing. Doctors should not be guessing. So I'm in a couple of hormone physician groups, and they post their questions in these groups. You'll be shocked at what they don't know. And they too are going to social media asking questions of other, what do you do for this? What did you do for this? How do you do? It's like, there's so much more to know about a patient than this. And the fact that they just are grabbing at straws themselves and not telling the patient, oh, by the way, this protocol I just put you on, I just learned about it in a social media group.
it's a little scary and stunning and just almost inconceivable that this is how our medical system is working, treating half the population. But it
At
is.
women's expense, all of this, if you look back for years, women are told you're crazy. They're withheld their estrogen, and then they've been ridiculed and made fun of and called Karen because of the behavior and how they feel when you withhold estrogen. This is why I get so heated about it, because I fell victim to this. And that's, why this podcast.
Well, you're definitely on a mission to educate women, and I think it's absolutely critical. And you're one of the few people that I'm aware of, and I've been researching and looking into this now for years, who has this level of expertise based on clinical experience. So, and I would just say, in terms of this last person who wrote in and your answer to that, and really all these questions, how absolutely important it is to have a coach to walk you through
Oh, yeah.
this process because all of these things come up. You don't have to have a coach forever,
No.
but these first few months, there's a lot of stuff going on. And it can be disconcerting, it can be scary, it can be confusing. There's a lot of temptation to take things off and stop and start and switch around and go to social media. Working with a coach keeps you on track, helps assuage these fears that come up and talk you through so you know what's going on.
You're so right, Maggie. I mean, I tried to do this without a coach, and this is why we pulled in coaching in our clinic. I mean, we just had so much more success. If you've got somebody holding your hand through the process to say, this is what's happening, this is what's going to go away, this is what we're doing next, and this is where we're going, and having absolutely everybody from the prescriber to the coach to the patient, where everybody's on the same page, everybody is using the same handbook, everybody is going towards the same destination of the hormone sweet spot. And this is really makes all the difference. And I've worked for years to make this available, and, happy to start really putting it out there now.
All right, so here's our last question for today, Marie. I had my first appointment with a provider certified with the Menopause Society. A little background. I had been seeing my GYN since April, trying various HRT methods, including progesterone, estrogen patches, and testosterone. I have felt very little relief of my symptoms. In fact, my biggest concern now is the depression I am experiencing. I met with this new doctor from the Menopause Society on Friday and was shocked when she wanted to stop all HRT, perform labs, and start birth control, NuvaRing, to help with my moods and depression. I reluctantly decided to give it a try because I'm so desperate to feel better. After processing a couple of days, I'm really struggling with this route of treatment. She ordered new labs and wants to review in 3 months. Basically, she said she wants to slowly add in HRT to see what is working and what is not. I'm just feeling completely defeated.
Maggie, I feel so badly for women that go this route. This is a very common way that women go to seek help getting their hormones balanced. I mean, it just blows my mind. We have well, it used to be the North American Menopause Society, but now they've changed their name to just the Menopause Society. And they are trying to position themselves as the gold standard of hormone replacement therapy for physicians, and educating them. The problem with the Menopause Society is they mostly only believe in first generation HRT protocols. They're big with pharmaceuticals. They're big with using birth control pill as hormone therapy and convincing women that oral contraception are hormones. They are not. Really, if a woman never wanted to get her hormones balanced at all, she would go to a Menopause Society certified doctor. This is one of the red flags for women to know that they will never get their hormones balanced by this provider, because they will always keep hormones low. This woman was going to see her gynecologist, which the training of a gynecologist is that estrogen is bad and causes cancer, and the patient should not be on hormones. And if they are, they should be on synthetic hormones, and which are the ones that many claim cause cancer, even though that's never been proven. These synthetic hormones are really not designed to restore estrogen. They are designed to trick the brain into thinking a woman has plenty of estrogen. So it suppresses the FSH, the barometer to estrogen, and it also keeps estrogen low, so that women are low in estrogen. They still feel cruddy, but they're told that they're fine because their FSH is low. Now, this gynecologist clearly didn't know what they were doing, because she was doing progesterone, estrogen patches, and testosterone, trying various methods. Now, this is really important because, I mean, it's been it's April, 5 to 6 months that she started this. This is barely enough time for her to try various methods in 6 months of estrogen, progesterone, and testosterone. Tells me this doctor has no idea what they're doing. And they just treated this as a crapshoot. And so now this patient is disgruntled. They didn't get the help they need. They got very little relief from the symptoms because the root cause of the symptoms wasn't addressed. And now she feels worse with depression and probably some other things that she didn't list here, because there are many symptoms associated with this type of protocol. But the depression is very concerning because women can get severely depressed. I mean, they can have massive depressive disorder. It's not unusual. And the doctors don't even realize that they're causing it. Prescribing low dose hormones keeps women hormonally deficient. And it's very clear, especially with all the data that's available, that one of the best ways to prevent depression and anxiety is to fully restore estrogen. Okay, so a woman went from a gynecologist to this Menopause Society certified doctor who stopped all HRT, performed labs, and then started birth control. Well, one, I'm surprised the gynecologist didn't do this because this is really their MO. But this is also very indicative of the Menopause Society. Take women off of hormones. Let's keep them in a state of hormone deficiency, because really the Menopause Society is funded by a lot of government funding and a lot of pharmaceutical money. And so really these guys are trained, or they're pawns, really, pharmaceutical drug reps. And, oh, let's take women off of hormones and then give them a pharmaceutical product and tell them that it's hormones, or tell them that it's in their best interest, when women just don't really realize that there's continuing down the road in estrogen starvation. And think if they're going to somebody who knows what they're doing. I mean, who wouldn't go to a doctor certified in the Menopause Society? You would think that that doctor would know how to balance hormones. And this is what I'm afraid of with the Menopause Society, as they're trying to get the HRT standards, that they'll tell doctors that, no, this is all women need this standardized HRT protocol, and which is what this is. This is very typical of what they're going to make standard, and it's going to make it harder for women to get hormones balanced. This is why it's so important for women to understand estrogen, how much they need, what HRT system will provide them what they need, and then how to find a provider who knows how to prescribe what they need. And these are really important. And so she started the hormonal contraception to help with her moods and the depression. But if you look at the packaged insert, even on the NuvaRing, one of the first things that happens, one of the first side effects of the NuvaRing is depression and anxiety. It's like, because those are the symptoms of menopause, of which this patient is still left in because she's not having a menstrual cycle. So really, this Menopause Society doctors put women in chemical menopause and keep them there. And then they sell products and treatments and surgeries and other things. And so this is also this is the grand racket. This is the conventional medicine treatment. This isn't even functional medicine. And then these doctors will go get trained. Some will go get trained in functional medicine and then learn second generation HRT, but it's still the mindset of low dose. So if you haven't heard or watched the podcast of the 4 generations of HRT and their clinical track records, I highly recommend you do so, because you'll learn quite a bit about the different types of HRT and what you might need.
Yeah, that's episode 6 for our listeners.
Yeah. So she did it because she was desperate. And this is what women do. They're listening to the doctor sitting in front of them. They feel so desperate and they're just praying that this is going to help. But they know as they are walking out the door or getting ready to hang up that Zoom call, that this isn't going to help. They leave the appointment more confused. They want to be hopeful, but they're more depressed. I would say the depression is stemming more from, and I'm not a doctor, but I would imagine how, because I went through this too, is how depressed a woman would be if you know that the doctor is putting you on a protocol that they are doubtful of. How could you be so certain about it? Well, let's try this. Let's try. And when you know that it's not going to work. Labs do need to be ordered anytime you start hormones, that you need to at least give it 3 months. But her labs will come back, because she's on the birth control. She'll come back with a low FSH and she'll come back with low estrogen. And then any symptoms that she will complain about, this doctor will put her on psychotropic drugs and other pharmaceuticals to manage the symptoms this patient will still experience. And then as the patient is explaining how horrible they feel, the doctor would say, oh, well, I have this medication, I have this medication, or I have this treatment, I have this surgery, I have this, I have this. And this is what women end up doing to the day they die.
I have a lot of empathy for this questioner because, and you and I have talked about this before, but certainly, the anxiety, the depression that can come with low estrogen is debilitating and it's terrifying. And often psychotropics do not help, they can make it worse. And so I really hope that this woman is listening and that she can find a better hormone doctor to work with.
Yeah, this is why I get so upset, because women are being used this way. They're kind of being they're shuffled through this system, and all the providers are talking about female empowerment and how they're helping women and they're serving women, and this is all about women, and it's not. They are using women. They are using their hormone deficiency symptoms to make a buck while they're withholding. Withholding estrogen should be a crime, especially when we have the data out there that we know how women feel with it, even on low dose therapies, how they feel with it and then what they feel without it. It's not like it's a guessing game at this point. And the fact that women are always left estrogen starved is a crime. It's a crime against humanity, because
Mm,
everybody feels the effects of female estrogen deficiency. Everybody.
yeah. Such a powerful episode today, Marie. Thank you so much for your expertise in answering these questions. I know that you have some thoughts that you want to leave our audience with to close.
I do. So listen, I'm going to leave you with 3 key things that you can do to increase your chances of getting your hormones balanced and keeping them balanced. Your only hope is you. You have to educate yourself. Number 1, it is super critical for you to learn about estrogen. Learn all you can about how much your brain and body require to thrive. And during your research, pay close attention to the data that is not there. The data that shows when women take therapeutic dose estrogen, what happens. And this was crystal clear to me when I started digging around. And then you'll ask yourself the same question I did, is where is this missing data? We should be able to see what happens to women when we fully restore hormones. But learn as much as you can about estrogen. That's number 1. Number 2, you need to learn about HRT. Not all hormone replacement therapy is the same. And this is why we encourage you to watch episode 6 on the 4 generations of HRT. If you know estrogen and what you need from estrogen, you can choose an HRT system designed to meet your clinical goals. If you want to manage your symptoms of hormone deficiency and take a bunch of products in addition to low dose hormones, you can do that with 1st and 2nd generation HRT systems. So then you would find a practitioner who would prescribe those hormones. 3rd and 4th generation HRT systems are designed for full restoration, to fully restore a healthy and incident-free menstrual cycle, so women don't have any side effects of hormone deficiencies, because there are no hormone deficiencies. And so if you find an HRT system designed for full restoration, you won't spend the rest of your life managing the symptoms of hormone deficiencies that you won't have. And then once you understand which HRT system will work for you, or a pretty good chance to work for you, then you can find a doctor, and that's 3. Then you'll be able to find a doctor who can prescribe a 4th generation HRT system so that you could get your hormones fully restored, such as the Panacea Sciences Advanced Hormone Balancing Clinic. That's our telehealth platform where we specialize in full hormone restoration using advanced HRT protocols. So I recommend you go to advancedhormonebalancing.com and book a complimentary discovery session. Let's see if advanced hormone balancing is good for you. It's not for everybody, but it is life-changing, and it can certainly change your life too. And so if there's something you would like us to consider talking on the show, or a question you'd like us to answer, feel free to DM me on social media. Many of you have. Thank you so much for that. or you can go to menopausemoxie.com/podcast and fill out the form there and send it in. Remember, everybody benefits when your hormones are balanced.